Chronic pain in the last 40 years has doubled.
Anything that's a threat to the brain will produce pain.
But if we do the right stuff, we can make your pain better. Our brain has these incredible chemicals. These are what we call the happy chemicals. There's about 24 different things we can do every day to actually turn those on. It ties to movement, sleep, nutrition, stress reduction. All of those things we know long-term will work, but it takes longer. And there's the catch. We've never injected as much as we do now. We've never drugged as much as we do now. It's not working. Today, more than 130 Americans will die from prescription opioids. Enough is enough.
Just being told that it was all in my head for years.
It hurts. Boxing hurts. Like, no one wants to get punched, especially in the face.
I thought for me it was hopeless. There was no answer but a pill.
What we know now about pain can revolutionize everything.
In school, we're taught pretty much that pain and tissue injury is the same thing. In a simplistic model, medical model, if you hurt yourself, you get pain. If you've got pain, you must have hurt yourself. And so we've been tying those together for the last 370 years in medicine, for that matter. But tissues heal, tissues get better, then why do you still hurt? Because pain is way more complex than that. And that's what happened to me, is patients would come in with chronic pain. It didn't make sense anymore because tissues heal, the knee's better, the ankle is better, but they still hurt. It was just this epiphany that shoulder, that knee, that back has a human being attached to it. And that took me down this path to learn more about how pain actually works.
You can have tissue injury without pain, and you can have pain without tissue injury. You have to look beyond the tissues. What's in their environment? What's in their social life? What's in their psychological life? You have to look at the whole patient, because anything can ramp up the nervous system. The brain is still wanting to protect something.
So we define pain as an unpleasant sensory and emotional experience that a person gets from either an injury or a potential injury. Pain protects us. It warns us there's something going on. Stop, pay attention, do something about it. If you step in a nail, there's an alarm going off that basically says, hey, there's a nail in your foot, take care of it. But we now know in about 1 in 4, 1 in 5 people in this world, something trips the alarm system, and then that system just keeps running and running, even though you remove the nail, which we call chronic pain or persistent pain. And now the minute you experience pain, it starts tying into your thoughts, your beliefs, your expectations, your experiences. So pain becomes just more and more and more complex. I mean, the quick fix is simple. We're in America, it's drugs, it is surgery, it is injections, it's quick, it's fast, etc. And that works for acute pain. But for chronic pain, the data is unequivocal, it doesn't work. Hey, I want to lose weight, but I don't want to go work out and take 6 months to get 10, 15, 20 pounds down. Give me the pill, I'm going to do it today. Pain does the exact same thing, but it comes at a cost, and we're seeing that cost.
Hi, my name is Melinda Birch. I am a mother of 5 children. My family for many years had been enjoying hunting. One fall day while we were out hunting, we were packing up the guns, and we assumed the guns had been emptied, and we were treating them like they were safe. And I knew right away. As soon as the gun went off, I reached down and I said, I've been shot, I've been shot. It was agonizing, but I also did realize that my children were there and they were watching me, and so I needed to be an encouragement to them. I ended up being life flighted to San Antonio. At first I thought I was going to need an amputation. My trauma team surrounded me, and the doctor, he immediately checked for a pulse in my foot, and sure enough, there's a pulse. He said, it's very faint, but we have a small one. They recommended that I get physical therapy about 7 weeks after my injury. I thought physical therapy was for people who sprained their ankle or something, you know, and I thought for me it was hopeless. There was no answer but a pill. I was writhing in pain. So I reached for a pill. I was doing it, and I wasn't seeing any recovery. I was just staying in the same amount of pain, and actually my pain was getting worse. Opioids only increases the need for more, and I saw that for myself.
I specifically remember the conversation that I had with Melinda on day one and voicing my concerns of dependence. When somebody becomes dependent on a medication, likely they're just doing what they were told to do. They're trying to help themselves in the way that they were given to help themselves.
Stephen, he told me one of the sad things that I see as a doctor is people like you that would never have addictions, ever turn to this. He said, and they become addicted. Opioids really do mess with your perception, and I had no desire to do anything. I didn't even want to leave my bed, but I did have to press forward for my family because I knew that they were struggling too as they're watching their mom, and not knowing the outcome either and what this is going to really look like. I turned to trust Stephen because I really didn't feel like there was any other option, and I was seeing my life was kind of falling around me. Nothing seemed to be taking the pain away, nothing was helping it to get any better, and then the depressing feeling was only increasing too.
She was able to understand that, there was a change that happened anatomically and biomechanically, but that didn't have to mean that she couldn't overcome it. And we were able to break it down to a very basic level for her to experience it.
Stephen, he taught me what was happening and that it's okay that you feel this pain and we're gonna try to work you through it. As I got off the opioids, he would ask me, so what hurts? And I'd say my whole leg. He said, I would like for you to be able to tell me where you hurt, not just your whole leg. It was about a month after I got off my opioids that I came in and he said, what hurts? And I said, right here hurts. And I could pinpoint it. And Stephen gave a big smile and he said, now I can help you.
I can tell you everything that you need to know, but until you actually experience that and start to overcome it and start to see the hope that comes from that, it's always conceptual. And when they start to gain hope and they start to gain change, then they really start to understand pain. And it's no longer pain misunderstood, but pain understood. And that really is the pathway to recovery.
We did these little teeny exercises that you feel like are ridiculous, but they hurt. And then he would slowly increase it to be more and more. And then I worked up to being able to run. And so another big moment for me was when I did finally actually have a race with my son down the road. I was like, yes, I can do this, and it was actually like a real run. I was like, we were actually having a race. I was like, I never thought that would be possible.
I'll never forget the text message I got from the top of one of the highest peaks around San Antonio, with her with our arms over her head saying, I did it. She went from thinking that she was never going to be able to walk again to summiting a mountaintop, and to be a provider as part of her story still just puts a smile on my face.
He walked me through a very long, probably year of physical therapy so that I could get back to my daily activities of homeschooling my children and living life, hunting and camping, and eventually I was back to my normal life. I mean, it took a year, but it really does work. There is a method to their madness, and I'm thankful.
My pain is not your pain. Every person's pain is individualized. We have experiences, we have memories, all kinds of things that actually impact how we experience pain. If we take a young toddler, I think it's very interesting to watch how they do what they do, because they have not been trained, they've not been conditioned. A child runs past dad, he's watching the football game, it's Sunday afternoon, and dad swats him on the rear end. Little Johnny turns around and Dad's face determines, do I cry or do I laugh? Because Dad can go, I got you, and he's laughing or whatever, or get out of here, I'm watching the game, the team's scoring, whatever. It's interesting, right? Because there's been an input to the system, then it's the context in which it is. We know that 60% of people's pain can be traced back to actually how mom and dad reacts when they have pain. Pain runs in families. If mom reacts a certain way, lives her pain a certain way, a child will start living their pain that way. They mirror what the parent's doing. And so we get conditioned over time. We know that kids that play contact sport have a smaller chance of developing chronic pain later because they get conditioned that pain is normal. We all get it. We all have bruises. Life is okay. I'm part of the team.
My name is Rihanna Rios. I was born and raised here in South Texas. Served 5 years active duty in the Army. Boxed all around the world for Team USA. I'm 8-0 as a pro now and just won my first title. I love to fight. People always say that you have to be a little crazy to get into a boxing ring, especially at this level. The discipline, the technique, the skill set you had to have, I don't think there's anything else like it. I had hurt my elbow my last fight, and I couldn't do certain things in here without being in excruciating pain. I couldn't even dress myself at times. Like, I was trying to be the best in the United States to be on the Olympic team, you know? So just having to tough it out was one thing, but like, how was I managing the pain to compete in these tournaments? They were like week-long tournaments, and you fought every day, you know? The mental aspect, I think, of boxing kind of teaches you how to control and manage your pain. I think as an average person, once you hit pain, you scale it back way too much. You have to learn to fall and get back up, especially being a boxer, right? You never want to say, oh, this hurts. It hurts. Boxing hurts. Like, no one wants to get punched, especially in the face. As an adult, it's understanding like, okay, pain is real, it's there, and if I can't take the pain away, what can I do to better manage it? And I think your average person, their first thing to do is put some ice on it, elevate it, rest, and take some ibuprofen, Tylenol, you know, rice. Me as an athlete, I'm hurting, I immediately go to Dr. D. She's my sports therapist. And I tell her, hey, this is going on, what can I do, what shouldn't I do? I had already done physical therapy previously, but I was doing the average person's physical therapy, so to say, and I could do those things, but like when I got in here, I couldn't throw a punch properly. She put me through a whole PT plan, and I was pressing weight like I never pressed before without pain. I gained a lot of trust in Dr. D when she would tell me how it really was. Like, sometimes as an athlete, we don't want to hear certain things like, oh, you shouldn't be doing this. You tell me not to come in here and do 10 rounds, I'm gonna do 12 just because I know I can do 12 rounds. She looked at me as an athlete and she made me see a different side of things. I knew immediately, like, all right, she knows what she's talking about, she knows what she's doing, she listens to her athletes, and I've been working with her since.
A lot of the times working with athletes that potentially do present with a higher pain tolerance, it's because it's their livelihood. And all they're thinking of is, I need to get back. So it's really understanding the athlete and building a program that is allowing them to trust me and then know that I have their best interest in mind. And working to build that trust, it starts from day one. You know, when they come in that door, they already don't want to be there because of that injury. So making sure that I acknowledge what they're going through. You know, yes, you did have this injury. What are your goals? And what do you want to see happen to get to where you want to be?
You know, pain isn't necessarily a sign to stop, it's a sign to listen. And that's when you take an intentional pause and understand the context of the situation, the history of what I'm working through, the perception of threat that might be going on, that those then become levers for us to change.
Trust is key in helping your patient recover. As clinicians, what we have to get better at overall is listening to our patient and our patient's story. If we listen closely, they will tell us what's going on. The best way any clinician can gain trust from your patient is knowing that you are listening to them and that you care about their story.
My name is Maddie Sauer. I identify as what is called a zebra. It represents what medical students are taught when they're in medical school. It's when you hear hoofbeats, you're supposed to think horses, not zebras. Ehlers-Danlos syndrome, their entire mascot is the zebra. Mostly my large joints are more likely to just dislocate doing minimal everyday activities. I was washing dishes yesterday and I was just holding the bowl and I subluxated my wrist and I had to twist my ulna and put it back into place. Ribs are supposed to be pretty horizontal. Mine are very vertical right now. As for the comorbidities that exist with Ehlers-Danlos syndrome, I have postural orthostatic tachycardia syndrome, which is POTS. Basically, my blood likes to pool in the bottom of my feet, and my heart has to work overtime in order to get that blood back up into my brain. by making my heart rate go extremely fast. It makes it feel that you can't trust your body. You don't know what's gonna go through a day-to-day basis. I feel like there was something wrong with me always, and not knowing what that was, but feeling that way was really taxing. Feeling like I wasn't being taken seriously by the medical community. I remember talking to my psychiatrist and being like, hey, this is what I think I have. And she guffawed at me, she laughed. Just being told that it was all in my head for years and that I was just this anxious little girl. And life is not fair, and that's okay. But was so many points of time where I was literally like begging for answers and just no one listening. Just being like, oh, just go to psych, you're fine. I'm very thankful that I have a diagnosis, I am. But I had to fight tooth and nail to get it, and that's not an uncommon experience. And it shouldn't take as much time and effort and pain and money in order to get that. Like, I had been poked and prodded and tested on and shocked and done night sleep studies and done all these things, when really all it took was to just look at me as a whole person, as a whole system, and be like, this is wrong, this is not how it should be. When I got those results back, I will never forget the look on the doctors' faces of being like, oh, this makes a lot more sense now.
When a patient trusts a provider, that really is the foundation for a therapeutic improvement. And when a patient knows that that therapist has their best interest in mind and the good of their outcome in mind, that patient's going to be willing to try to do new things that they wouldn't have otherwise. I think the provider also needs to be able to trust that they have the full picture so they can make good decisions with what the patient has told them.
You just need one person to listen to you, to take you seriously, or to recognize maybe like what something could possibly be. Shane is probably one of the first people that I was able to really connect with on a way that I wasn't able to do with any other kind of medical professional. Not only is he helping me take care of myself, like physically, but mentally. Because with Shane, it's like, how are you feeling today? Just present in the moment with you and trying to make sure that you're good every step of the way. Pushing you when you need it, laying off when is needed. It is just priceless.
When a patient finds like a clinician that believes in them, there is a click that happens. When they feel that click, they know it. It's game changing, man. Like, it allows you to push the patient a little bit past what they thought they could do previously. Pain is as mental as it is physical. Some would argue more mental than anything. And each visit was definitely a roller coaster. The hips going out, the ribs going out. When pain becomes chronic, it will affect the mental for many of these patients. So being able to make that connection that's deeper than like the professional, clinical, almost sterile, make it more of like a friendship. And I think through some of the things you saw today, like Maddie is a friend to me for sure. I think like the EDS was one thing for sure, but then like I think it was more the POTS that really affected you more than anything, because like you would like get up, I need to sit down, get up, I need to sit down. And we made like good progress on that for sure. Like,
absolutely. But also just having our great conversations and talking about all of our
talking about music and hanging out, the occasional conspiracy theory, At the same time, like intertwining like the education, the exercise, and all that,
just being able to nerd out.
Because at the end of the day, like what you're going through sucks,
Yeah.
But like we were able to make it as less sucky as possible.
Exactly.
Just through having a good time and making the exercises as like functional and like goal specified as possible. It's like, you look so good right now. I love it.
I've been hula hooping.
Really?
That's what I always tell therapists. Don't underestimate that. You in the clinic on the front line, making that one person's day better. I always teach my residents this. When a patient comes in your clinic, you see them for 30, 40, whatever minutes you have. What can I do today to make your life better? That's all you have to do. What is that? Maybe it's a stretch. Maybe it's listening. Maybe it's doing that exercise. Maybe it's reviewing their exercise program. Maybe giving them some advice, giving them some hope. But what can I do today to make your day better? And next time I see you, let's make that day better as well.
Pain is not to be feared. Movement is very good. You don't have to have pain medicine every time you hurt. You can still move even though you hurt a little bit, and you're gonna be okay. One patient at a time, one kid at a time, one teacher at a time, one parent at a time, and we can't give up.
If I can teach you that the pain that you experience is actually a normal human experience. You're not weird, it happens to all of us, welcome to the human race. It actually shifts you from cup half empty, woe is me, to the, well, that makes sense, we all have it, the guy with the funny accent explained it, we all have it. And it's interesting because then the cup shifts from half empty to half full.
I'll never forget that feeling of everything finally making sense and coming into fruition, like, I was right. I was right.
You also take away some of your fear. Pain that is understood is not to be feared. And so if you don't fear your pain, you're willing to do stuff like, ah, it's my back, I'm gonna keep moving. And that actually moves us in the other direction, because now you get pain, you don't have a half empty cup, you have like, nah, I'm gonna be okay. Then you don't have as much fear, and then you start doing more stuff. And when you do more stuff, you feel better, and it starts the other way. So we strongly believe in teaching people more about pain, so where they can understand it and go, I got it, I'm gonna be okay. Now, I cannot run a marathon, but can I go for a nice, easy, brisk walk today? Yeah. Can I do a few stretches my therapist showed me? Absolutely. And slowly work our way in the other direction.
My hope is that they understand what the things are that they can do to help control their pain. It doesn't mean that they don't have the support of a physician alongside them, but it empowers them to manage their condition in a way that doesn't put them at risk for dangerous side effects or dangerous dependence or a life stuck not doing what they want to do.
People expect to live without pain. It's like they think it's an American right that we should live pain-free, but that's not true. We have to learn how to live with our pain.
The number one thing that I want all my patients and all my prospective patients and all my friends and all my family to understand is that you're complex, an individual, and what that means is that you have the opportunity to influence your particular situation through movement, through understanding your thoughts and cognition, and through your sleep and through good habits and through your diet. But it really does start with you. So find providers that you trust, find trusted individuals that help you take control of your health and empower you to manage the situation that you're in.
Say hello. It is the following spring from when the documentary was filmed. I had my surgery for my rib resection of my 12th rib and my reconstruction of my rib cage on my left side. I am extremely happy to report that so far it has been a success. And that feels so good to say. I'm able to dance and sing. It sounds cheesy and cliche, but I will say that I absolutely have a new lease on life.